Good evening. On behalf of the Women in Cardiology Committee, DEI Task Force, and the Advocacy Committee, we would like to extend you a warm welcome to the New York ACC Advocacy 101 webinar. I'm Dr. Tandon. I'm chair of the Women in Cardiology Committee and vice chair for community outreach on the DEI Task Force. I'm joined today by Dr. Pragya Ranjan, my co-chair on the New York ACC Women in Cardiology Committee, who is a cardiologist at Westchester Medical Center. And I'm going to pass on the mic to Dr. Ranjan.
Thank you, Saman. I'm actually going to go ahead and introduce our first speaker. So we have with us Dr. Aaron Kipkart, who is the NYACC Advocacy Chair and currently a Medical Director in Early Clinical Development at Regeneron Pharmaceuticals. Dr. Kipkart has served as a member of the ACC Heart PAC Executive Committee, as well as a member of the ACC Health Affairs Committee, and he also serves as a delegate on the American Medical Association House of Delegates. And with that, I will hand over the mic to you, Dr. Kipkart.
All right, thank you. And thank you for this opportunity. And I think this is a great chance to work together across our different organizations within New York ACC to talk about something that I'm very passionate about. So I'm just going to take 10 or 15 minutes and give it a little introduction in terms of what advocacy means, and also talk about some of our state efforts here in New York. We're also going to hear from one of our ACC staff representatives from DC, Meg Novak, who's going to tell us a little bit about what we're doing at the federal level. And then we're going to open it up for questions. So please, if something comes up over the course of the next 30 minutes or so, feel free to enter those questions into the chat, or if you're patient, like I often am not, you can wait until the end and come off mute and ask your question directly to any of us on the panel. So to get started, I thought I would give just a bit of background on what advocacy means and where it originates. And so this is a famous photo that, at least in the DC circles, that was shared with me by our Vice President of Advocacy at the ACC, Nick Morse. And this is actually President Grant. And for many people, they think the term lobbyists or the activity of lobbying originated from what is being depicted in this photo, which is it's actually President Grant hanging out at the Willard Hotel on Pennsylvania Avenue in Washington, D.C. And it was thought that he would often spend time there, and people who wanted to get his ear, wanted to advance their cause, wanted to get his support, would wait in the lobby of the hotel for the president's attention, and then share their opinion. And so many people think that's where the phrase lobbying began. And so even though that dates back now over a century, that name still sticks. And unfortunately, people still think that's what lobbying or what advocacy means, is that it's a few privileged people talking to leaders in Washington, D.C. But what I hope to convince you of this evening, and what I want to leave with you at the end of our hour together, is that advocacy actually means much more than hanging out in a fancy hotel in Washington, D.C. So advocacy strictly means, according to the dictionary at least, the act or process of supporting a cause or a proposal. And so it's not just federal advocacy that is important, but it's actually advocacy across the spectrum of every organization, and in our case, any system or group that has an influence in how healthcare is delivered. And so what does that mean for the American College of Cardiology? And so for those who haven't been to Albany, the photo in the upper left-hand corner is the State House in Albany for New York. So obviously there's a lot of advocacy that occurs there. And we all recognize the structure to the upper right, that's the Capitol building. where I think a lot of us think of when we think of advocacy. But it's also in our hospital systems. It's also in our federal organizations. For those who have been to DC, they might recognize the brutalist building in the lower left-hand corner as the Department of Health and Human Services. And so for those of us in cardiology, that federal agency in particular holds a lot of influence in how we practice cardiology on a day-to-day basis. And so when we talk about advocacy, we're not just talking about those activities at the federal level in Congress. We're not talking about the interactions that we have with the health authorities or regulatory agencies like the NIH or the FDA, but also those activities at the state level. And in New York State, we have the advantage of having a very strong partner in the Medical Society of the state of New York that is a leader in advocating on behalf of physicians in New York State. And so we've worked with them closely on many issues. Some of them I'll talk to you about tonight. But then there's also local advocacy. And I hope to talk about that a little bit. And so that can be anything from sponsoring or co-leading a community event, speaking to your hospital governing society, advocating for a specific policy or bill at your local city council. Those are all different types of advocacy, and the ACC is here to support you in all of those, even if it's not in Capitol Hill in DC, which is obviously very important, but is not the only thing that we do. So I recognize that this slide is going to be very busy. I'll point you to our website, which is acc.org/advocacy if you want to learn more about any of these. But I show you this because I want to speak to the breadth of issues that we advocate on behalf of. And so the big categories are, first and foremost, champion access to care for everyone. And actually, that's not just Americans, although, of course, as New Yorkers, that's primarily who we care for, but it's actually advancing cardiovascular care worldwide. And that can be through our relationships with other cardiovascular societies globally. And to do that, we think we have to have a healthy healthcare system. And so that means supporting clinicians and making sure that we have equitable value-based care that provides high quality care for our patients, but also supports the clinician providing that care. We think that the future of cardiology is different than what it looks now. And so we want to be able to support that both at a national level and a local level. One example of a local way that we do that is through the expansion of telehealth services and making sure that in New York State, we're able to provide high quality care even to patients that are not in our waiting rooms. We also want to support and bolster the clinician workforce. We think that's important. And then finally, we all are well aware that Medicare provides a large part of the care that we provide, or supports the large part of the care that we provide. And so making sure that Medicare is sustainable. So I know Meg will probably talk about some of these, so I don't want to take any more time on that, but want to instead talk about what we've been doing in New York. So there's a number of issues that we've been able to support that we're making inroads on. One of them is preventing sudden cardiac death in athletes. I think many people are aware that there has been a nationwide effort to improve AED access, and there is a bill that perhaps Meg will tell us more about in Congress that would support access to AEDs. But a lot of that happens locally, and that requires funding at a state level. And that includes things like paying for AEDs to be placed in sports facilities. And we know that the district that you live, the zip code that that your kids go to school in, can in many ways dictate how far away they will be from an AED. And those who have access to AEDs are more likely to survive a sudden cardiac arrest And obviously those that don't have access have much worse outcomes. And so that's a big priority for us in New York State. And we have the benefit of working with other organizations, including the NFL, which obviously has an outsized voice nationally to be able to advance that cause. We're also working to increase awareness and diagnosis of hypertrophic cardiomyopathy. I don't know if our past governor is here, but Shahari Naidu, he actually wrote a book about hypertrophic cardiomyopathy. It happens to be his clinical practice, and we're thrilled that we can support him as a New York chapter in increasing awareness about hypertrophic cardiomyopathy. And there's a specific act called the Healthy Cardiac Monitoring Act, which would improve access to high-quality care for adolescents and teenagers that can include screening visits, so that if they are at risk or may have undiagnosed hypertrophic cardiomyopathy, they're identified early before they have a bad outcome. And then the last one, which I want to spend a bit of time on because it's one that we're very passionate about here, is banning non-compete agreements or restrictive covenants. So I have a couple more slides on this in case you haven't heard of these before. Restrictive covenants or non-compete clauses are contracts that are typically built into employment contracts, which can limit your ability to engage in certain types of activities. And so they're not just in medicine, they're actually across many professions, and they're really designed to keep employees in their place of practice. And for many ways, in many organizations, they can be a good thing, because if you're spending a lot of money or effort to recruit high quality talent, like for instance, a cardiologist, you want to be able to keep them. But there are also unintended consequences of these types of covenants. And one of them is that it restricts mobility for clinicians. In particular, in New York State, where we have essentially 3 large healthcare systems, if you're employed by one of them on Long Island, for instance, and you decide you want to switch jobs to another healthcare system in New York State, you may be limited by your ability to do so based off of a non-compete clause. And so let me just show you some of the examples of what they can do. They can restrict your area of practice. They may require that you don't practice anywhere within a 50-mile radius of where your now competitor practices. And so I think back when clinicians were largely independent and they might have had 1 or 2 offices, maybe wasn't such a big deal. But now when you're talking about healthcare systems that might have 100 offices located across the entire state, you can imagine that these non-compete clauses can make it very difficult to stay in the state of New York. And so we view this as a patient access issue. And it's something that we advocated for at the local and also at the national level. And so people may be aware that in 2023, the Federal Trade Commission issued a proposed rule that would ban non-compete clauses in virtually every employee contract. So that was really exciting for us. The New York ACC submitted comments on behalf of our membership. And actually, we went even further and we polled our membership. Some of you may have received that survey asking if you were in favor or opposed to non-compete agreements, and the vast majority of our membership was opposed to them. And so we submitted those comments, and we were very happy that when it was announced earlier this year that the FTC would move ahead with the proposed rule, which was scheduled to go into effect in September. I probably should have used some animation on this slide, but the punchline is unfortunately on the right, which is that despite broad support, the non-compete ban has actually been struck down already by a federal judge. While it's likely to be appealed, I don't think anyone is very optimistic that that rule will be able to stand. And so there's now increased pressure and interest in shifting then those activities to the state. where it's much less likely that that could be overturned. So this is the current map of state non-compete bans. You can see that there's a handful of states as of 2022 that have outright banned them, a few more that permit them, but with restrictions. And then there are states like New York, which frankly we're in the minority of now, that permit non-compete clauses without any restrictions. So it's an area that we will continue to be active in through this year and next. But I want to just share it as one opportunity where we can take an issue that may have a nationwide impact, but where we can really focus our efforts at the state level. And we're very hopeful to get a bill passed either this year or next year in New York State. So I want to leave you with a few tips of how to get involved in advocacy at a local and state level, and then I'm going to turn it over to my colleague. So the first thing about advocacy is that it's about relationships. And those relationships can seem superficial at first, but you'll be very surprised how quickly those can develop as you become a source of expertise for your lawmakers. And so I would encourage you, if you don't know already, know who your local, state, federal lawmakers are. And if you don't yet have a relationship with those people, send them a letter. We make it very easy on the national level to send a letter to your representative and your senators. But get to know them. When there are issues that come up that impact you and your practice, let them know. They're usually thrilled to hear from you. And you would be surprised, even if you don't think they're going to listen, because maybe it's a senator's office. You think there's no way Senator Schumer is going to respond to my email, but use your credentials, whether you're a physician or a nurse practitioner, a PA who's participating in advocacy. They view you as an expert, and so leverage that. And if you're nervous about any of it, we have a great team, both at the state and the national level, that can help you get in touch with those people. And then I would encourage you also to leverage your relationships. And so we're going to hear a little bit about tonight how advocacy can go beyond the ACC. I've already mentioned the State Society for New York, but we also frequently partner with other organizations. So I mentioned the NFL on AED access. Community organizations. If you happen to belong to a church group, or you belong to a bunch of bird watchers, and you want to use that connection, some of the strongest advocacy comes from people who think the same. And usually those kinds of groups, you all have the same opinions. And so you can use that, and certainly many voices is stronger than a single voice. So with that, I am going to turn it over and introduce my colleague and friend, Meg Novak. So I'm going to stop sharing, Meg, if you want to start sharing your slides. Meg is our director of the Heart PAC, which is our political action committee for the American College of Cardiology. And she also happens to be a very experienced federal advocacy expert. And so she's going to talk through some of the opportunities at a national level. And then we'll be available for the panel if there are any questions that come up. So Meg, thank you for being here tonight. I'll turn it over to you.
Thanks so much, Dr. Cathcart. It's so great to be with you all tonight to talk a little bit more about advocacy at the federal level. Dr. Cathcart did a great job talking about what you all are doing in New York at the state level, and you'll certainly see a lot of the similar themes continue through because no matter whether it's local, state, or federal level engagement is still engagement, and building relationships is crucial and as a part of advocacy. So I'm going to go through and walk you through what it means when we're talking about congressional affairs. Dr. Cathcart shared a little bit about our priorities. I'm going to give you a little bit of a taste of what that looks like at the federal level. We'll talk through some engagement opportunities. So what does this look like? How can you get involved as an individual contributor? And then we'll dive into Heart PAC. So moving along, congressional affairs, what does that mean? It means that we are working with members of Congress on either legislation that they introduce or helping to craft legislation that's addressing key issues that we're hearing from you all that are affecting day-to-day care delivery. We're also reviewing that legislation, soliciting feedback from you all to make sure that we are having an ongoing conversation. Certainly the dynamics in Congress change daily. One side wants one portion added to it. So what is the other side going to do to come up with a compromise? So we're constantly working with members in concert with the Health Affairs Committee, which is Advocacy's governing body, as well as any other ACC stakeholder groups. So, that could mean if there is a particular issue that comes up that would involve a section, bringing in leadership of that section for their thoughts on things. So we're working with different groups within the college to make sure that, we're making the right moves and we're prioritizing the legislation that's going to impact you in the best way possible. And then lastly, we're working with other medical societies. Certainly, there is a shared interest in advocating for Medicare reimbursement reform, streamline prior authorization practices. And so we're working in coordination with other medical specialty societies and other allies to make sure that we're doing everything we can to work together to advance those priorities. So you will see Dr. Cathcart had previously shared a little bit more detailed graphic, but I'm going to give you some background as to why we landed on the priorities we landed and what our intent was behind rebranding things. So this was just introduced this year. We identified 5 overarching priorities where we will slot issues as they come up under each priority. And that's really meant to help, members understand what is the driving force behind the narrative that we're bringing to Congress, to state legislatures, to be able to, when you have a one-on-one meeting or with a member, or you're bringing them in for a practice visit, you really understand sort of what that argument looks like and what we're going in with to appease, different competing interests, right? So certainly a lot of the issues could fit under any of these. But if we're focused on telehealth, for example, we're really going to be coming at this from a care transformation and optimization standpoint. If we're talking about, clinician well-being, well, that's going to fall a little bit more into clinician workforce because we want to make sure that we're bolstering that workforce. Prior authorization could fit into a number of categories, but we put that in foster care transformation and optimization because we're talking about a lot of that real-time, immediate electronic approvals. So I'm going to dive into what this looks like at the federal level, but I just wanted to give you an understanding of sort of why we reshaped this the way that we did. So it'll be something that will continue on from year to year, and hopefully you'll find this really useful as you attend legislative conference or as you become more involved in meeting with your state legislators or federal lawmakers. All right, so we're looking at established sustainable Medicare payment practices. We're looking at this from 2 lenses. We're looking at it from a short-term reform standpoint as well as long-term reform. So short-term reform, you may remember it took quite a long time for Congress to pass a budget, but they did, and they did provide some relief from the cut that took effect on January 1st. So you might say 1.68%, that's a little bit of a strange number. Because it was slightly delayed, it didn't take place at the end of 2023, they adjusted it to reflect what 1.25% would have looked like at the start of the year. That was the number that they were floating near the end of the year. They just couldn't quite make it across the finish line. So, certainly we don't want to continue going back to them asking for relief year to year, but, we were able to preserve about $75 million for cardiovascular clinicians this year. Right now, we're facing a 2.8% reduction for 2025. So we are working with lawmakers. They're currently in recess, coming back soon. So we do expect to see some more activity there in terms of sign-on letters, as well as some potential legislation introduced to mitigate that cut. That said, we really need to focus on long-term reform. So because there has been so much activity, as Dr. Cathcart mentioned, you might not think that that letter to your senator makes a difference. But all of this pressure that we've been putting on Congress, coming to them, talking about short-term relief, but also, really wanting to engage them in long-term reform, that's made a difference. And I think you'll see that in the legislation that's listed here. There's legislation out there that would provide an annual inflationary update tied to the Medicare Economic Index. There's also two pieces of legislation, one in the House, one in the Senate, that would increase the budget neutrality threshold from 20 to 53 million. And that's really helping to mitigate one area getting a decrease if another area gets an increase from year to year. So again, helping to relieve some of the cuts that we see year to year. Obviously, there's some more work to do in this area, but I just wanted to kind of give you an understanding of what we're talking about when we're looking at the short-term asks and the long-term asks. Going into foster care transformation and optimization, as I mentioned, telehealth fits really nicely into here. You'll see there is one bill that's kind of a broader telehealth bill listed there. There is a lot out there right now, actually. There are quite a few telehealth bills, so we're not quite sure which one Congress is going to identify as the one they want to advance in a larger package. But I wanted to highlight this one because it did advance out of the Ways and Means Committee, so that one did make some movement. We also have one that's a little bit more specific to cardiovascular care, and that's the Sustainable Cardiopulmonary Rehabilitation Services in the Home Act. It is a mouthful, but that would permanently allow patients to receive in-home cardiac and pulmonary rehabilitation services. So really, we're just looking to make a lot of these flexibilities that were made available during COVID permanent. There's a lot of interest. It's just a matter of what this looks like and how it makes it across the finish line. All right. As I mentioned, prior authorization is another key issue that fits under this overarching theme. And we've got two pieces of legislation, one of which, is the Gold Card Act, modeled after Texas law. That one might be a little bit difficult to make across the finish line because Dr. Burgess, who is the lead on this bill, is retiring at the end of this year. So we're not quite sure who might pick it up in the next Congress. But there is the Improving Seniors Timely Access to Care Act that was introduced just a couple of months ago with sweeping bipartisan support immediately, over 100 original co-sponsors. It was introduced last Congress, and it had a lot of support, but it was really expensive. However, since CMS did introduce a rule that addresses a lot of the elements in here, what this legislation is really attempting to do is to make it so that what was listed in the CMS rule cannot easily be rolled back. So we're hopeful to see this move across the finish line this year. Moving into the workforce bucket, bolster the clinician workforce now and for the future. There's certainly some work on GME policy proposals in the Senate, but I think the one that I've seen the most action on recently is workplace violence. So there's the SAVE Act, which would essentially establish federal penalties for anyone who commits violence or intimidation against a healthcare worker. And those penalties would be similar to ones that already exist for airline attendants. And then let's look at champion access to care for all. There are actually two pieces of legislation I'm going to talk about that are AED related. It's great to see, this sort of thrust unfortunately thrust into the spotlight after Damar Hamlin's incident last year, but Congress has really taken that incident and used it as a means to address, a growing issue of not having access to AEDs, and really focused with this legislation access to AEDs on schools, as they're the epicenter of communities. So it would establish a grant program for elementary and secondary schools to not only make AEDs available, but also implement education, awareness, and training programs. Going back to that really quickly, the other piece of legislation I wanted to mention here is the HEARTS Act. So this does include some elements of the Access to AEDs Act, but it also includes some awareness about cardiomyopathy and establishing education and awareness around that. Why do both of these bills exist if they are doing or attempting to do similar things? So the HEARTS Act is led by Frank Pallone out of New Jersey, and he essentially identified a vehicle with which they could introduce this that already existed. So utilizing an existing funding vehicle. Again, a lot of this is about just putting puzzle pieces together and see what's going to fit. So we're supportive of both of these pieces of legislation, but we'll see where Congress lands on that. And then finally, I wanted to talk about peripheral artery disease. So we did have the Amputation Reduction and Compassion Act introduced. We were working with a coalition to get this across the finish line. It was a part of our legislative conference talking points last year. Unfortunately, the lead on this piece of legislation passed away in April. So we've just been working with the coalition to see if there is going to be someone else that will pick this up in his honor. That was a lot of information. I know that certainly you are all definitely furiously taking notes, but don't worry, we will be sure to send you information and links to everything that I've discussed and links to everything I will discuss. But you can certainly stay up to date with us on social media. So we are active on X, formerly Twitter, at Cardiology. Here we'll share interesting news articles, any long-form acc.org articles we write on trending issues, and links to our action alerts. We also communicate via email. So we have the ACC Advocate, our weekly advocacy-focused newsletter. These are short blurbs, just things that are happening that have happened in that week. If there is more information we want to provide, we'll have a learn more link, which will link to an acc.org story or some other external article. We also have a series that we started a couple of years ago called Heart Pack Update. And this is shared through the Advocate as well as quarterly through our Heart Pack email platform. But we, through this series, try to make sure that you have everything you need when it comes to advocacy at your fingertips. Some of them are a little bit more in depth, some of them are a little bit broader. But here I've listed some of the key ones that I think are really helpful if you're starting your advocacy journey. So the first one I would recommend, and I will be sure to provide this in a link for Katerina to share with all of you, is an overview of ACC advocacy. You'll see the images on this slide are clips of that, but it provides, the different core areas: congressional affairs, state government affairs, regulatory, payer and care delivery, what each core area does and how they all interact in the advocacy process. We also have best practices for meeting with lawmakers, which Dr. Cathcart mentioned. And we also provide some federal advocacy updates on a quarterly basis. I will give you a heads up that we will be sharing one in the Advocate this week. So be on the lookout for that, for the latest updates on some of the legislation I talked about. And there are many other subject matters that we cover. So you can find all of these archived on heartpack.org, but please be on the lookout for the next one and the rest of the ones we've got lined up for this year. Now moving into engagement. There are certainly many opportunities at the federal level. I will say the premier one is attend the legislative conference in Washington, D.C. That's coming up September 29th through October 1st. Certainly, we are also able to facilitate meetings with your legislators in the district There are district working periods on the congressional calendar every year, and we are happy to create custom talking points for you and connect you with their scheduler to make sure that you're able to sit down with them and take advantage of the time they have back home. And again, I will send this out so you can take a look at every which way that you can get engaged. But what I really want to highlight is the ACC Advocate Checklist. This is something that you can sign up to participate in. There is no deadline with which you have to participate. This is at your leisure, as as you have time in your schedules. But it really provides an outline for how you can get involved in advocacy, engaging in the different elements to see how they all work together. So first up, you have Take Action. This is really focused on our action alerts. Those are really easy to do. You may have seen an alert roundup email sent out on Saturday listing all of our live federal alerts. You click the link, you fill in your contact information. There's already a pre-written message. You can add your own note to it if you'd like, and you hit send. The system will automatically know who your legislator is and if it's asking for support of a specific bill, whether or not they have already supported it. Meet with your lawmakers, another key element. Certainly this can be done in DC or back in the district. Attend legislative conference, become a HeartPAC member, which I'll talk about in just a little bit. Engage on social media. We do have, some hashtags you can use, and spread the word. Certainly all of you are here because someone told you how great it was to be involved in advocacy. You've been interested in joining. This is really how we get folks involved. It's by word of mouth. It's by, reaching out to one of your colleagues about, one of these issues that that they are facing day to day and how they can help make an impact, whether it's at the state level or at the federal level on that issue. So we certainly want to make sure you all are engaged and you are able to share that with your networks as well. So legislative conference is coming up September 29th through October 1st. You will see on these slides, it's a pretty full agenda. I'm just going to highlight a couple of the key sessions that I think will be interesting to you all. So we kick off on Sunday. There are some section meetings that take place on Sunday. I will highlight the Women in Cardiology Leadership Workshop from 9 to 2. This you will find if you register for the conference. I send out an email to all registered attendees with more information about the agenda. But certainly if you would like more information, please feel free to reach out and I'm happy to share that with you all. But the conference itself really kicks off on Sunday evening. So HeartPAC hosts a signature dinner where we bring in folks who are, sort of have insider knowledge when it comes to politics to really give them a personalized conversation about, either what to expect in the next Congress or what's going to happen with the next presidential election. So this year we've got Mike Allen and Jim Vandehei. They are both co-founders of Politico and Axios. So they're the perfect people to help us navigate digital media in a presidential election year and certainly talk through what we're seeing in some of the headlines. It's well timed, just a month out from the election. Kicking off the educational sessions on Monday, the couple of sessions that I want to highlight here, we'll be doing some health policy presentations. So we've got one focused on AI. We've got one focused on advocacy at home. So really the nuts and bolts of state advocacy, kind of taking what Dr. Cathcart has already talked about and sort of learning different case studies and different chapters and how they were able to see, something from beginning to end and successfully push through legislation at the state level. We'll also have a legislative issue briefing where we'll have our congressional affairs team on stage talking through this year's talking points, giving you all the information that you'll need so that you are prepared for Hill meetings on Tuesday with your lawmakers. And then finally, the last session I want to flag is the team-based care on Capitol Hill. So we will be bringing a couple of physician members, cardiovascular care team members, as well as an early career professional on stage to talk through how they would approach the talking points for this year from their different perspectives or their different roles on the care team. Again, we'll have some more programming going into the afternoon. But really, the big day is Tuesday, October 1st, where you get to meet with your lawmakers. I want to emphasize that, we have folks join at every level of advocacy engagement, whether they've not even gone to acc.org/advocacy or read The Advocate, to those who this is their 20th legislative conference. So we really try to structure it to make it inclusive for absolutely everyone. If you're a first-time attendee, during registration, you'll be asked about the Legislative Conference Advisor Program. I highly recommend selecting that. There's no additional cost or anything. All we do is connect you with a veteran conference attendee, so you have someone outside of your own chapter to ask questions if you're too afraid to ask in a larger setting, and really have them help you navigate and make the most of your conference experience. So it is one of the most fun conferences. I mean, I might be slightly biased, but that ACC offers, and it's a really great way to dive a little bit more into some of the non-clinical competencies and connect with members, your colleagues, in a different way. So I know I mentioned HeartPAC through a lot of this, but HeartPAC really is ACC's cardiology party. We solicit voluntary contributions from members, so that is separate from ACC dues, and we use that to make sure that we are supporting congressional champions of cardiovascular care. So what that means is we want to make sure that there are members in Congress who understand healthcare policy, who understand how it impacts you and your patients, who are acting on cardiology issues to really shape the future of cardiovascular care. We provide a HeartPAC report every year of everyone we contribute to. And one of the things that I think is very unique about HeartPAC versus a lot of other PACs is that we are exactly 50-50 when it comes to the number of Republicans and Democrats we support, as well as the amount we support to Democrats and Republicans. And that's really intentional because we want to make sure that members understand that we are nonpartisan and that we are using those contributions that we do collect wisely. And here is just a slide showing how HeartPAC stacks up. I do want to note this is not every medical specialty society, so ACC is not at the bottom, but certainly there is opportunity for growth, particularly when you compare ACC to other organizations of similar sizes. We're continuing to increase our participation, and anything that you all are willing or would like to do, we are very appreciative of. Again, it goes a really long way in supporting these congressional champions. Right now, we've got 60 members that are retiring this year, and a lot of those are, physicians with institutional knowledge of healthcare policy historically to really understand how we got to where we are today. We're losing a lot of that, and so HeartPAC has been a really crucial tool in identifying who some of those emerging champions will be to make sure that we're retaining a lot of that knowledge that would otherwise be lost. So with that, I will stop sharing my screen and remind you all that I will be sharing a lot of information. So don't worry if you felt like it was information overload. You'll have links to everything.
That was great. That was definitely a lot of information, but I feel like we all learned a lot from that. With that, I'm going to go ahead and open up the panel discussion. Audience, if you guys have any questions, please feel free to share in the chat. But I'm going to start by actually asking Dr. Tandon and Dr. Kifkart, how did you guys get involved in advocacy? Both of you have a lot of experience. Can you just walk us through, how each of you just got involved and what people that want to be involved at the local, state, or national levels, what should they be doing?
So I'll start, and my journey in advocacy really started at a subspecialty society level with the American Society of Nuclear Cardiology. I was given the advice, to look for involvement either at a smaller society or at the state level. And as I was getting more involved with ASNIC, I started looking at which committee should I volunteer on. And even though the Health Policy Committee was something foreign to me, health policy, I decided to, I chose to do that. And partly the reason behind was I thought I had experience from the academic setting. I had worked with in city hospitals, even a private practice setting. And I felt I knew what are the resources at these places, what are the challenges, and I felt I could bring that background to the Health Policy Committee. And so I've been member of the Health Policy Committee since 2013 and have advocated on the policy, regulatory, and legislative issues impacting nuclear cardiology and on behalf of the nuclear cardiology professionals and the patients. Now, as I said, it was foreign to me, so it took a little while to get to learn the language, but it takes a little while. And I think one of the important things I learned in my committee meetings was never to shy away from asking questions. And however, because we are not used to the language, we are not used to the terminology, so it really helped to understand and break it down. Now, this also led me to some more exposure, which was at the Capitol. And, first time I volunteered, there were senior people who knew what they were doing, thankfully. And so we went and met congressional staffers. And over the period, I really started enjoying doing that. Went to the Capitol Hill for several issues. One of the important ones we worked on was the PAMA law, which is Protecting Access to Medicare Act. And this was enacted in 2014. And that is what established the Medicare Appropriate Use Criteria program for advanced diagnostic imaging. And, we advocated for the statutory delay, Congress repeal of this program, because it was complex, it was prescriptive, there was a lot of cost and administrative burden and took away flexibility from physicians. And on top of that, there was no metrics of quality or patient outcomes. So I feel, with our efforts, not just our society, but other societies together, we were able to halt that program after a decade of work. And another one which was mentioned earlier was the access. Another effort was the bill which we co-sponsored, which was the Improving Seniors Timely Access to Care Act. And that increases the transparency and streamlines the prior authorization process in the Medicare Advantage programs. So it was really a learning experience to, to go meet the congressional staffers, see what they know about these things, and what you can educate them, and where is the change or what we are asking for. And then, these opportunities subsequently led me to be asked to be a delegate. First time I was an alternate delegate at the AMA House of Delegates, and now I serve as the delegate for ASNIC at the AMA HOD. So the House of Delegates is really the legislative and policy-making body of the American Medical Association. And they have a wide representation. There's state medical associations, national medical societies, the AMA sections, and also the federal part with the public health services involved. So it's a huge organization and very well represented, I would say. For me, the policy-making process at the House of Delegates was eye-opening. From the pro and con debates on the floor, there's days of deliberation and voting, but I feel it has been a tremendous learning opportunity. And I didn't know about it because I went from ASNIC to being asked to do that, and now I've taken on this role. And I highly advise people to look into looking at AMA. and the House of Delegates will, policies are being made on healthcare issues and healthcare systems. So in conclusion, from my side, I would say that there are many paths to advocacy. You can start small, you can start at a subspecialty society or local, state level. And it might be a different journey for every individual. I think we can bring our strong clinical expertise, diversity of thought, a commitment to our patients, and a passion for the field and advocate for change. Thank you.
Yeah, and I'll just add that actually I met Dr. Tandon for the first time at a American Medical Association meeting. And so you started by saying that you arrived at advocacy late, but look at you now. You have a lot of activities that you're involved with. And so I think it goes to show if you're passionate about something or an issue, it doesn't take much to get really involved. And I think it speaks to the power of advocacy. So I'll be brief because I know that we are limited on time and I want to make sure we get to a couple of questions. So I started in advocacy as a medical student, but my first interaction with the American College of Cardiology was actually a legislative conference. And so I'll put in another plug for that. I received an award that was available for FITs. And at the time, Pat O'Gara was the president of the American College of Cardiology, and I was his fellow. So I had been doing advocacy for a little bit through the AMA. And so I had gone to Capitol Hill before. He had not. And he was president of the ACC. And I remember we walked into Senator Warren's office. She was there. And I just started kind of spouting off all these different bills that much like how Meg was talking about all the different legislative priorities. I had them all memorized. And I remember Dr. O'Gara said it to me afterwards, how do you know all this stuff? And I'm learning about valvular disease from him. He writes the guidelines and I'm teaching him a little bit about advocacy. So I think that the language that we use in advocacy, it can be a little intimidating, but it's not that much different than reading an ECHO report. And I think with practice and with mentorship, it's possible for anyone to do it. And it doesn't have to be at the national level. You don't have to go to a senator's office. We have Dr. Curtis here. She's been with me in state senator meetings and does a terrific job talking about the importance of various issues. One of them was the non-compete ban that I talked about earlier. So I'd encourage people, if they're interested, just get started. And you can start at the state level. We have lots of strong advocates here, and then we'd be happy to get you plugged into the national level. But I think legislative conference for me was my first big opportunity with the ACC, and I've been hooked ever since, as Meg knows.
And I think you hit a key point there where you said you can be the president of the ACC and you still may not know as much about advocacy as other people. I think that's apparent to me as Meg was going through her slides. I'm pretty sure most cardiologists don't know, how much effort is going into trying to get these bills passed at both the state and the national level. I was very happy to see that there's so much effort going into, increasing or expanding telehealth services. I think that's something I've heard so many cardiologists talk about. We have sick patients and they don't get equitable access to healthcare. I remember you had mentioned, Dr. Kithcart, that the National WIC Committee is doing a lot of work in the space of maternal mortality, increasing awareness of maternal mortality. Can you shed some light on that? Talk to us a little bit more about that.
Yeah. I think it's something actually that a lot of us here, I know we're here on behalf of both the Advocacy Committee, the WIC Committee, but also our DEI task force. And so I'm glad that we have members from that here. So, and I think this is an issue that touches on all three. So many may already know that maternal mortality in the United States continues to get worse, actually. And it's primarily due to cardiovascular disease. And so what we're doing at the ACC, as well as the American Medical Association, is first and foremost increasing awareness that this is a major cause of mortality for mothers, and a lot of it is due to risk factors that are treatable, like hypertension and diabetes, obesity obviously contributing. And so it's something that touches across all of our committees and groups, because it's also a equity issue where maternal outcomes are worse in certain neighborhoods or certain socioeconomic classes. And so what the ACC and the AMA are trying to do is really close those gaps and deliver high quality cardiovascular care to all mothers at the time of pregnancy, so that we can address this specific issue. But I think it's just one example of an issue where many stakeholders can get involved and do the right thing for our patients.
I don't know if we have much time left, but Simon, do you think we can squeeze in one more question?
Yeah, sure.
Should we squeeze in? Well, I know, Meg, you did talk about the PAC and how it's different from the ACC, but just as a reminder to our listeners, because we're towards the end of our time, can you just maybe summarize how the PAC is different from just being a part of the ACC, and why it's important for us to keep that in mind?
Yeah, absolutely. So HeartPAC is a separate financial entity from the college. It has to be so to abide by Federal Election Commission regulation. That said, too, when it comes to our contributions, the most that we can accept in one contribution in a year from an individual is $5,000. You might say, that's a lot of money, but compared to something like, a foundation or another nonprofit or charity, that means it takes a lot more participation from individuals to really have the resources to be able to, contribute $1,000, $2,500, $5,000, which is the max, to a candidate for a particular election. So, certainly anything that you can do to support HeartPAC is incredibly impactful. It's really the ACC's tool to be able to educate either, current leaders or emerging candidates about the issues impacting cardiovascular care. We're typically contributing to those who are running for re-election. That is something that is managed through the HeartPAC Executive Committee, but certainly from time to time, there may be a physician running for an open seat that will go ahead and support. So we're keeping a close eye on what, the pulse of different changes and redistricting and different election cycles bring about to make sure that we're making the best use of funds. So anything that you can do for HeartPAC is really an investment in cardiovascular care, because it makes certain that we're getting folks in Congress that really do care about health policy and making a difference for you and your patients. Dr. Cathcart, anything you want to add as our HeartPAC Executive Committee member representation?
No, I mean, I think that the important thing is what you said earlier, Meg, which is that the HeartPAC is really the cardiology party, and we work with everyone in Congress to advance high quality cardiovascular care on behalf of our patients. And that means that we can go back to our members and say that we really represent the entire field of cardiology. We don't pick favorites, and we don't play to certain sides. So I think it's something we all are very proud of at the organization. So thanks, Meg, for being here. I think we're probably out of time, unfortunately, but I know this has been a great conversation for me, and it's been great to talk to all of you.
Yeah, unfortunately, we are out of time, and I want to be respectful of everyone's time here, but thank you both so much. This was so educational, and I think everyone got a lot out of it. There will be more NYACC WIC webinars, and I'm sure we'll try and work with the Advocacy Committee and the DEI Committee to, co-host more of these. But I just wanted to one more time remind everyone that the ACC Legislative Conference is happening September 29th to October 1st in DC. And if you're interested in advocacy, this is a great conference to be a part of, especially if you're an FIT or you're earlier in your career. Great time to get started, or anywhere in your career, to be honest. We will be sending out information, everything that you guys heard during this session. A bunch of links and a lot of information will be coming your way, including information regarding the ACC Legislative Conference. But thank you everyone for joining, and we look forward to seeing you at future ACC conferences.
Thank you all.
Thanks, everyone.